Medical Assistant Administrative Review. Question 1. For a 24-hour urine collection, which patient instruction is correct? Option A. Discard the first void, then collect all urine for the next 24 hours as instructed. Option B. Stop the collection after the container is half full. Option C. Mix the urine with tap water to preserve the specimen. Option D. Collect only the first morning urine on the second day. The correct answer is option A. Discard the first void, then collect all urine for the next 24 hours as instructed. A 24-hour urine collection begins after the first void is discarded and includes all urine produced during the timed period. Missing specimens or ending early can make the result inaccurate. Adding water or collecting only one void is not consistent with the procedure. Question 2. A patient brings an advance directive to the office. What is the purpose of this document? Option A. To replace all consent forms for every future procedure. Option B. To communicate the patient's wishes for healthcare decisions if the patient cannot speak for themselves. Option C. To authorize the medical assistant to prescribe medication. Option D. To guarantee that insurance will pay every claim. The correct answer is option B. To communicate the patient's wishes for healthcare decisions if the patient cannot speak for themselves. Advance directives document patient preferences or decision makers for future healthcare situations when capacity is impaired. They support patient autonomy and guide the healthcare team. They do not determine insurance payment, expand medical assistant scope, or eliminate procedure-specific consent requirements. Question 3. A competent adult patient refuses a prescribed vaccine after education. What should the medical assistant do? Option A. Administer the vaccine while distracting the patient. Option B. Record that the vaccine was given to keep the chart complete. Option C. Tell the patient they must leave the practice immediately. Option D. Notify the provider as needed and document the refusal according to policy. The correct answer is option D. Notify the provider as needed and document the refusal according to policy. Competent adults have the right to refuse recommended care after receiving appropriate information. The refusal should be communicated and documented according to policy. Administering against consent, falsifying documentation, or reacting punitively is unethical and unsafe. Question 4. A patient has a bleeding forearm laceration in the office. Which first aid measure should be applied first? Option A. Remove any forming clots repeatedly to inspect the wound. Option B. Hold the wound under hot water until bleeding stops. Option C. Apply direct pressure with appropriate protective equipment. Option D. Apply a tourniquet immediately for every minor cut. The correct answer is option C. Apply direct pressure with appropriate protective equipment. Direct pressure is the initial first aid measure for most external bleeding and should be performed using standard precautions. It helps control bleeding while additional care is arranged. Repeated clot removal, hot water, or routine tourniquet use for minor wounds can worsen injury or be inappropriate. Question 5. Which medication instruction should be rewritten to avoid a dangerous abbreviation? Option A. Take 1 tablet daily. Option B. Take 1 tablet by mouth. Option C. Take 1 tablet with water. Option D. Take 1 tablet QD. The correct answer is option D. Take 1 tablet QD. Certain abbreviations can be misread and should be avoided in healthcare documentation. The abbreviation QD can be mistaken for other dosing instructions, so daily should be written out. Clear written instructions reduce medication errors, while the other phrases are understandable. Question 6. A sharps container in an examination room is filled past the marked fill line. What should the medical assistant do? Option A. Remove several syringes and place them into a biohazard bag. Option B. Push the contents down to create more space for additional needles. Option C. Continue using the container until the lid can no longer close. Option D. Stop using the container and follow facility policy for safe replacement. The correct answer is option D. Stop using the container and follow facility policy for safe replacement. Sharps containers must not be overfilled because protruding sharps increase the risk of needle stick injury. The container should be taken out of use and replaced using the facility's safety procedure. Compressing, removing, or continuing to add sharps creates avoidable exposure hazards. Question 7. A sterile instrument touches the unclean edge of the Mayo stand cover. How should it be handled? Option A. Consider the instrument contaminated and replace it with a sterile one. Option B. Wipe the instrument with a dry gauze pad and continue. Option C. Use the instrument quickly before contamination spreads. Option D. Place the instrument back into the sterile pack with the others. The correct answer is option A. Consider the instrument contaminated and replace it with a sterile one. Sterile items that contact non-sterile surfaces must be considered contaminated. Replacing the instrument protects the patient from infection risk. Wiping, rushing to use it, or returning it to the sterile pack can contaminate the field further. Question 8. Which observation requires immediate attention after obtaining vital signs on an adult patient? Option A. Respiratory rate of 16 breaths per minute without distress. Option B. Blood pressure of 190/122 mmHg with severe headache. Option C. Oral temperature of 98.6 degrees Fahrenheit after resting. Option D. Pulse of 72 beats per minute with regular rhythm. The correct answer is option B. Blood pressure of 190/122 mmHg with severe headache. Severely elevated blood pressure with symptoms may signal a hypertensive emergency and requires prompt provider notification. Normal temperature, respiratory rate, and pulse findings do not carry the same urgent risk. Medical assistants should report abnormal findings and follow emergency protocols rather than independently diagnosing or treating. Question 9. The term tachypnea in a patient note refers to which finding? Option A. Rapid breathing. Option B. Slow pulse. Option C. Low blood pressure. Option D. Painful urination. The correct answer is option A. Rapid breathing. Tachypnea combines tachy, meaning fast, with pnea, meaning breathing. Medical assistants should connect word parts to physiologic findings when reading documentation. The incorrect choices represent different systems or different prefixes and suffixes. Question 10. In a fire emergency, what does the acronym RACE commonly remind healthcare workers to do? Option A. Rescue, alarm, contain, and extinguish or evacuate. Option B. Read, assess, code, and enter the fire area. Option C. Remove, apply, clean, and educate. Option D. Run, assemble, call, and exit without closing doors. The correct answer is option A. Rescue, alarm, contain, and extinguish or evacuate. RACE is a common healthcare fire response framework that prioritizes rescue and alarm before containment and extinguishing or evacuation. Closing doors and following facility procedures help limit smoke and fire spread. The distractors omit key fire safety steps or describe unrelated tasks. Question 11. Before performing a resting 12-lead ECG, which preparation is most appropriate? Option A. Ask the patient to exercise vigorously to improve electrical signal. Option B. Have the patient hold a cell phone during the tracing to stay relaxed. Option C. Place electrodes over thick clothing to preserve modesty. Option D. Explain the procedure, provide privacy, prepare the skin, and position the patient supine if tolerated. The correct answer is option D. Explain the procedure, provide privacy, prepare the skin, and position the patient supine if tolerated. Resting ECG quality depends on patient understanding, privacy, proper skin contact, and minimal movement. Supine positioning is standard when tolerated, with modifications made according to patient condition. Exercise, clothing under electrodes, and electronic distractions can interfere with the tracing. Question 12. When disposing of a used venipuncture needle, which technique best supports OSHA bloodborne pathogen safety? Option A. Place the needle on the tray until the end of the patient visit. Option B. Break the needle from the syringe before discarding it. Option C. Recap the needle carefully before walking to the disposal area. Option D. Activate the safety device and place the needle directly into an approved sharps container. The correct answer is option D. Activate the safety device and place the needle directly into an approved sharps container. Needles should be disposed of immediately in puncture-resistant sharps containers after activating available safety features. Direct disposal reduces handling and minimizes the chance of percutaneous injury. Recapping, delaying disposal, or manipulating the needle increases exposure risk. Question 13. A patient scheduled for a minor procedure asks why a timeout is performed. What is the best explanation? Option A. It is performed only when the patient is unconscious. Option B. It verifies the correct patient, procedure, site, and other key safety details before starting. Option C. It replaces the need to identify the patient earlier in the visit. Option D. It allows staff to take a break during the procedure. The correct answer is option B. It verifies the correct patient, procedure, site, and other key safety details before starting. A procedural timeout is a safety pause designed to prevent wrong patient, wrong procedure, or wrong site errors. It confirms critical details with the team before the procedure begins. It is not a staff break, a substitute for earlier identification, or limited only to unconscious patients. Question 14. A referral is most likely needed when which situation occurs? Option A. A managed care plan requires approval for the patient to see a specialist. Option B. The patient wants a printed after-visit summary. Option C. The provider asks for a clean examination table. Option D. The patient changes an email address in the portal. The correct answer is option A. A managed care plan requires approval for the patient to see a specialist. Referrals are commonly required by certain insurance plans before specialty care is covered. The medical assistant may help coordinate paperwork, scheduling, and documentation under office policy. Portal changes, visit summaries, and room turnover are not referral situations. Question 15. When registering a new patient, which information is most important to verify before the visit begins? Option A. Only the patient's preferred pharmacy and favorite appointment time. Option B. The provider's lunch schedule and the patient's parking location. Option C. A previous patient's account number if the last names match. Option D. Demographics, insurance information, identification, consent forms, and contact details. The correct answer is option D. Demographics, insurance information, identification, consent forms, and contact details. Accurate registration supports patient identification, billing, communication, and consent. Demographic and insurance errors can lead to safety issues, claim denials, or privacy problems. Using unrelated account information or focusing on non-essential details does not meet registration needs. Question 16. Minutes after an injection, a patient develops wheezing, facial swelling, and hives. Which emergency is most likely? Option A. Anaphylaxis. Option B. Mild seasonal allergies only. Option C. A delayed billing reaction. Option D. A routine vasovagal response without airway concern. The correct answer is option A. Anaphylaxis. Wheezing, facial swelling, and hives after medication exposure suggest anaphylaxis, a life-threatening allergic reaction. The medical assistant should activate emergency procedures and assist within scope. Mild allergies, vasovagal episodes, and billing issues do not match the airway and allergic findings. Question 17. When leaving a voicemail reminder for a patient, which approach best protects confidentiality? Option A. Describe the diagnosis and all test results in the message. Option B. Mention the patient's full medical history so they know the call is important. Option C. Leave only limited information according to office policy, such as the practice name and callback number. Option D. Ask a neighbor to deliver the medical details if the patient does not answer. The correct answer is option C. Leave only limited information according to office policy, such as the practice name and callback number. Voicemail reminders should limit protected health information because others may hear the message. Office policy should guide what details may be left. Sharing diagnoses, test results, or medical information through neighbors creates privacy risks. Question 18. After explaining home blood pressure monitoring, which technique best confirms patient understanding? Option A. Ask the patient to demonstrate or describe the steps in their own words. Option B. Give only written instructions and end the visit immediately. Option C. Document understanding without speaking to the patient. Option D. Ask, "Do you understand?" and assume a nod means mastery. The correct answer is option A. Ask the patient to demonstrate or describe the steps in their own words. Teachback asks patients to restate or demonstrate instructions, allowing the healthcare team to identify misunderstandings. It is more reliable than yes or no questions. Written materials are helpful but should not replace confirming comprehension when education is provided. Question 19. A patient becomes angry about a long wait and raises their voice at the front desk. Which response demonstrates therapeutic communication? Option A. Ignore the patient until they stop speaking. Option B. Tell the patient they are not allowed to feel upset. Option C. Raise your voice so the patient understands the office is busy. Option D. Remain calm, acknowledge the frustration, and offer to check on the delay. The correct answer is option D. Remain calm, acknowledge the frustration, and offer to check on the delay. Therapeutic communication uses calm tone, active listening, and acknowledgement to de-escalate conflict. Offering practical follow-up shows respect without promising something outside control. Arguing, dismissing feelings, or ignoring the patient can escalate the situation. Question 20. After running an autoclave cycle, which indicator provides the strongest evidence that sterilization conditions were effective? Option A. A biological indicator showing that resistant spores were destroyed. Option B. A dry wrapper on the instrument pack after the cycle ended. Option C. An operator note stating the autoclave door was closed during the cycle. Option D. A piece of autoclave tape that changed color on the outside of the pack. The correct answer is option A. A biological indicator showing that resistant spores were destroyed. Biological indicators are the most definitive routine test of sterilization because they use highly resistant spores to verify microbial destruction. Chemical tape shows exposure to certain conditions but does not prove that all sterilization parameters were met. Dry packaging and operator notes are useful observations but are not equivalent to biological monitoring. Question 21. When taking a telephone message for the provider, which documentation is most complete? Option A. Only the caller's first name because the provider will remember. Option B. A sticky note with the words "Call patient soon." Option C, caller name, patient identifiers, date and time, reason for call, callback number, and action taken. Option D, a message documented under another patient's chart to save time. The correct answer is option C, caller name, patient identifiers, date and time, reason for call, callback number, and action taken. Telephone documentation should be clear, complete, and placed in the correct record, including identifiers, time, reason, contact information, and action supports continuity of care. Vague notes, incomplete identification, or wrong chart documentation can lead to errors. Question 22. Which scheduling method groups similar appointments, such as physicals or injections, into designated time periods? Option A, cluster scheduling. Option B, wave scheduling only for emergencies. Option C, alphabetical scheduling by last name. Option D, double booking every patient. The correct answer is option A, cluster scheduling. Cluster scheduling reserves blocks of time for similar visit types to improve workflow and resource use. It can help staff prepare rooms, supplies, and documentation efficiently. Double booking, emergency-only waves, or alphabetic scheduling do not describe this method. Question 23. A patient slips in the hallway but states they feel fine. What should the medical assistant do? Option A, place blame in the medical record before speaking with anyone. Option B, ignore the event because the patient denies injury. Option C, ask the patient to sign a statement promising not to report it. Option D, notify the provider, assess according to role, document objective facts, and complete an incident report per policy. The correct answer is option D, notify the provider, assess according to role, document objective facts, and complete an incident report per policy. Falls must be addressed even when the patient initially denies injury because symptoms can develop later. Objective documentation and incident reporting support patient safety and risk management. Ignoring the event, blaming others, or pressuring the patient is unprofessional and unsafe. Question 24. A patient collapses, is unresponsive, and is not breathing normally. What is the priority action? Option A, wait 10 minutes to see whether the patient wakes up. Option B, activate emergency response and begin CPR if trained and indicated. Option C, search the chart for insurance coverage before acting. Option D, give oral fluids to stimulate breathing. The correct answer is option B, activate emergency response and begin CPR if trained and indicated. Unresponsiveness with absent or abnormal breathing requires immediate emergency activation and CPR by trained personnel. Early recognition and intervention are critical links in survival. Delaying for paperwork or giving fluids is unsafe and does not address cardiac or respiratory arrest. Question 25. During venipuncture, how long should a tourniquet generally remain in place before it may affect specimen quality? Option A, until the patient reports numbness. Option B, no longer than 1 minute. Option C, at least 5 minutes. Option D, for the entire time the patient is in the room. The correct answer is option B, no longer than 1 minute. Prolonged tourniquet application can cause hemoconcentration and alter certain laboratory values. A general rule is to release the tourniquet within 1 minute or as soon as blood flow is established according to policy. Leaving it on for several minutes or until symptoms occur is unsafe and can affect results. Question 26. Which instruction is appropriate for a midstream clean-catch urine specimen? Option A, collect the first drops of urine before cleansing the area. Option B, touch the inside of the lid to keep it from falling. Option C, cleanse the area, begin urinating, then collect urine midstream without touching the inside of the container. Option D, fill the container with toilet water if urine volume is low. The correct answer is option C, cleanse the area, begin urinating, then collect urine midstream without touching the inside of the container. A midstream clean-catch specimen reduces contamination from skin and genital flora. Cleansing first and collecting the middle portion of the stream helps produce a more reliable specimen. Touching sterile surfaces or adding water contaminates the sample and can invalidate results. Question 27. In preparation for a minor office procedure, who is responsible for explaining the risks, benefits, and alternatives needed for informed consent? Option A, the provider performing or ordering the procedure. Option B, the medical assistant independently, because consent forms are administrative documents. Option C, the patient's insurance representative, because payment is involved. Option D, the receptionist, because scheduling created the appointment. The correct answer is option A, the provider performing or ordering the procedure. Informed consent requires clinical explanation of the procedure, risks, benefits, and alternatives by the qualified provider. A medical assistant may witness a signature or verify completion according to policy but should not independently obtain clinical consent. Scheduling and insurance roles do not replace the provider's responsibility. Question 28. According to standard precautions, which assumption should guide a medical assistant when handling blood and body fluid specimens? Option A. All blood and certain body fluids should be treated as potentially infectious. Option B. Gloves are unnecessary when the patient appears healthy and afebrile. Option C. Only specimens from patients with known infections require protective handling. Option D. Body fluids are infectious only when visible blood is present. The correct answer is option A. All blood and certain body fluids should be treated as potentially infectious. Standard precautions require healthcare workers to apply infection control practices to all patients regardless of diagnosis or appearance. Treating blood and certain body fluids as potentially infectious reduces occupational exposure risk. The other choices rely on assumptions about the patient or the specimen and can lead to unsafe practice. Question 29. A chemical disinfectant spills in the clinical area. Where should the medical assistant look for handling and cleanup guidance? Option A. The safety data sheet for that chemical and the facility spill policy. Option B. A coworker's guess based on the chemical smell. Option C. A patient education brochure about nutrition. Option D. The appointment schedule from the previous day. The correct answer is option A. The safety data sheet for that chemical and the facility spill policy. Safety data sheets provide information about hazards, protective equipment, first aid, storage, and spill response for chemicals. Facility spill policy adds local procedures and reporting steps. Guessing or using unrelated materials can lead to unsafe exposure. Question 30. Which patient should generally receive the earliest available urgent appointment or emergency direction based on office protocol? Option A. A patient reporting sudden facial drooping and arm weakness. Option B. A patient asking for routine vaccine records. Option C. A patient calling to update a mailing address. Option D. A patient requesting an annual wellness visit next month. The correct answer is option A. A patient reporting sudden facial drooping and arm weakness. Sudden facial drooping and arm weakness can indicate a stroke and require immediate escalation according to protocol. Scheduling decisions should prioritize potentially life-threatening symptoms. Routine wellness visits, record requests, and address updates do not require the same urgency. Question 31. When communicating with a patient who has hearing difficulty, which approach is most appropriate? Option A. Shout from another room to make words louder. Option B. Cover your mouth so the patient focuses on sound only. Option C. Face the patient, speak clearly at a moderate pace, and reduce background noise. Option D. Assume the patient cannot participate in the conversation. The correct answer is option C. Face the patient, speak clearly at a moderate pace, and reduce background noise. Patients with hearing difficulty often benefit from seeing the speaker's face and having background noise reduced. Clear speech at a moderate pace supports understanding without being disrespectful. Shouting, covering the mouth, or excluding the patient impairs communication. Question 32. Which instruction is most appropriate after applying a transdermal medication patch? Option A. Massage the patch vigorously to force medication through the skin. Option B. Place the new patch directly over the old patch for steady absorption. Option C. Cut the patch in half if the ordered dose is lower. Option D. Document the application site and time after removing any old patch as ordered. The correct answer is option D. Document the application site and time after removing any old patch as ordered. Transdermal patch safety includes removing old patches, applying the new patch as directed, and documenting site and time. Multiple patches, cutting patches, or vigorous massage can alter drug delivery and increase adverse effects. Documentation also helps prevent duplicate dosing. Question 33. When preparing a patient for an examination, which action promotes both safety and dignity? Option A. Ask the patient to undress in the waiting area to save time. Option B. Leave the door open so staff can enter quickly. Option C. Explain what clothing to remove, provide a drape, and leave the room while the patient changes if appropriate. Option D. Assume the patient knows what to remove without instructions. The correct answer is option C. Explain what clothing to remove, provide a drape, and leave the room while the patient changes if appropriate. Clear instructions, privacy, and draping help patients feel respected and prepared for examination. These steps also reduce confusion and support efficient clinical workflow. Open doors, unclear directions, or exposing the patient publicly violates dignity and privacy. Question 34. Before giving an ordered injection, the patient states, "I had hives after this medicine last year." What should the medical assistant do? Option A. Document the statement after administering the injection. Option B. Give half of the dose to see whether symptoms occur. Option C. Proceed because hives are not relevant to medication safety. Option D. Hold the medication and notify the provider for further instructions. The correct answer is option D. Hold the medication and notify the provider for further instructions. A history of hives after a medication may indicate an allergic reaction and must be addressed before administration. The safest action is to stop and notify the provider rather than proceeding. Reducing the dose, ignoring the report, or documenting after administration does not protect the patient. Question 35. Point-of-care glucose quality control results fall outside the acceptable range. What should the medical assistant do? Option A. Change the control result so it falls within range. Option B. Skip quality control because the device was working yesterday. Option C. Report patient results if they appear consistent with symptoms. Option D. Do not report patient results until the problem is resolved according to quality control policy. The correct answer is option D. Do not report patient results until the problem is resolved according to quality control policy. Out-of-range quality control means the testing system may not be reliable. Patient testing should be paused and corrective action followed before reporting results. Guessing, altering QC records, or skipping controls violates laboratory quality principles. Question 36. An adult patient reports dizziness when standing. Which vital sign technique is most appropriate to assess this complaint? Option A. Use a pediatric cuff to detect subtle blood pressure changes. Option B. Measure only oral temperature after the patient has stood for 5 minutes. Option C. Skip the pulse measurement because posture affects only blood pressure. Option D. Measure orthostatic blood pressure and pulse according to facility protocol. The correct answer is option D. Measure orthostatic blood pressure and pulse according to facility protocol. Dizziness with position changes can indicate orthostatic hypotension, so blood pressure and pulse are assessed in different positions. Facility protocols commonly include lying, sitting, or standing measurements with timed intervals. Temperature alone, improper cuff selection, or omitting pulse does not evaluate the physiologic response adequately. Question 37. A specimen is collected for laboratory testing. When should the medical assistant label the specimen container? Option A. Before the patient arrives, using the room number as the identifier. Option B. After results return from the laboratory. Option C. Immediately after collection in the presence of the patient using 2 identifiers. Option D. At the end of the day when all specimens are batched together. The correct answer is option C. Immediately after collection in the presence of the patient using 2 identifiers. Specimen labeling must occur immediately after collection and in the presence of the patient to prevent identification errors. 2 approved identifiers should match the order and specimen label. Prelabeling by room number, batching later, or labeling after testing creates unacceptable risk of misidentification. Question 38. While updating an electronic health record, a medical assistant discovers that yesterday's blood pressure was entered in the wrong patient chart. What is the proper response? Option A. Ask a coworker to chart under a shared login to fix it quickly. Option B. Leave the error because changing a chart is never allowed. Option C. Delete the entire encounter so no one can see the mistake. Option D. Follow the error correction policy by making a dated correction or notifying the appropriate person without deleting the audit trail. The correct answer is option D. Follow the error correction policy by making a dated correction or notifying the appropriate person without deleting the audit trail. Medical records must be corrected using approved procedures that preserve integrity and auditability. A dated correction or escalation ensures the record remains accurate without hiding the original entry. Deleting records, leaving known errors, or using shared credentials creates legal and safety problems. Question 39. During venipuncture, a patient becomes pale, diaphoretic, and says they feel faint. What should the medical assistant do first? Option A. Tell the patient to stand and walk around quickly. Option B. Continue drawing blood because the tube is almost full. Option C. Remove the needle safely, activate the safety device, and protect the patient from injury. Option D. Leave the patient alone to get a glass of water. The correct answer is option C. Remove the needle safely, activate the safety device, and protect the patient from injury. Signs of syncope during venipuncture require immediate prevention of injury and safe needle removal. The patient should be supported, monitored, and assistance obtained according to protocol. Continuing the draw, making the patient stand, or leaving them alone increases risk of injury. Question 40. Before obtaining a manual blood pressure, which positioning step promotes the most accurate reading? Option A. Ask the patient to hold the arm in the air during the reading. Option B. Place the cuff over the antecubital space and inflate immediately. Option C. Support the patient's arm at heart level with feet flat on the floor. Option D. Have the patient cross the legs to stabilize the body. The correct answer is option C. Support the patient's arm at heart level with feet flat on the floor. Blood pressure technique requires proper posture, arm support, and cuff placement to reduce measurement error. Supporting the arm at heart level helps avoid falsely high or low readings. Unsupported arms, crossed legs, and incorrect cuff placement can distort the measurement. Question 41. Upon reviewing a patient's chart, the medical assistant sees the term bradycardia. What does this term mean? Option A. An abnormally fast respiratory rate. Option B. A normal rhythm with skipped documentation. Option C. An abnormally slow heart rate. Option D. Inflammation of a vein. The correct answer is option C. An abnormally slow heart rate. Bradycardia refers to a slower than expected heart rate for the patient's age and condition. Recognizing common prefixes such as Brady helps decode medical terms on exams and in charts. The distractors confuse cardiac rate with breathing, inflammation, or documentation status. Question 42. Which action supports accurate inventory control in a medical office? Option A. Keep sterile and dirty supplies together for convenience. Option B. Order large quantities without tracking usage or storage space. Option C. Store expired supplies in exam rooms until they are used. Option D. Check expiration dates, rotate stock, and reorder supplies before par levels are critically low. The correct answer is option D. Check expiration dates, rotate stock, and reorder supplies before par levels are critically low. Inventory control ensures that safe, unexpired supplies are available when needed. Rotating stock and monitoring par levels reduce waste and prevent shortages. Using expired supplies, overordering blindly, or mixing clean and dirty supplies can affect safety and cost. Question 43. While removing contaminated gloves, which technique helps prevent contamination of the hands? Option A. Pull both gloves off by the fingertips and place them on the counter. Option B. Grasp the outside of one glove near the wrist, peel it off inside out, and remove the second glove without touching the contaminated exterior. Option C. Snap the gloves off quickly to avoid contact with the skin. Option D. Wash the gloves with soap and water before removing them. The correct answer is option B. Grasp the outside of one glove near the wrist, peel it off inside out, and remove the second glove without touching the contaminated exterior. Glove removal should keep contaminated exterior surfaces away from the skin. Peeling gloves inside out and handling the second glove from the clean interior reduces self-contamination. Washing reusable gloves, snapping gloves, or setting contaminated gloves on surfaces spreads microorganisms. Question 44. Which action is most appropriate when a medical assistant receives a verbal order from a provider in an urgent situation? Option A. Change the order to what seems easier to perform. Option B. Repeat the order back for confirmation and document it according to policy. Option C. Ignore the order because verbal communication is never used. Option D. Tell the patient to remember the order instead of charting it. The correct answer is option B. Repeat the order back for confirmation and document it according to policy. Read back or repeat back helps confirm accuracy when verbal orders are permitted by policy. Proper documentation and authentication requirements protect patient safety and legal integrity. Altering, failing to document, or automatically ignoring permitted urgent orders can create errors. Question 45. A provider orders blood cultures and coagulation testing. Which specimen should generally be collected first? Option A. Blood culture bottles or tubes. Option B. Lavender top tube. Option C. Gray top tube. Option D. Serum separator tube. The correct answer is option A. Blood culture bottles or tubes. The order of draw helps prevent additive carryover and specimen contamination. Blood cultures are generally collected first to reduce the risk of microbial contamination. Lavender, gray, and serum tubes come later in the order depending on the test sequence. Question 46. When opening a sterile package, which action helps maintain the sterile field? Option A. Touch the inside of the wrapper with bare hands to flatten it. Option B. Place the sterile field below waist level for convenience. Option C. Reach across the field to open the far flap last. Option D. Open the flap farthest from the body first and avoid reaching over the sterile contents. The correct answer is option D. Open the flap farthest from the body first and avoid reaching over the sterile contents. Sterile technique requires preventing contamination of sterile contents and avoiding reaching over the field. Opening the far flap first helps keep the hands from crossing the sterile area. Low placement and barehand contact with sterile surfaces break sterility. Question 47. A provider orders a wound culture from a draining lesion. Which collection principle is most appropriate? Option A. Collect the specimen from the area indicated by the provider using sterile technique before contaminating the site. Option B. Swab only intact skin several inches away from the lesion. Option C. Collect the specimen after applying topical antiseptic into the wound unless directed. Option D. Use a cotton swab that was stored loose in a desk drawer. The correct answer is option A. Collect the specimen from the area indicated by the provider using sterile technique before contaminating the site. Wound cultures require a representative specimen collected with sterile supplies and proper technique. The collection site and timing should follow the provider order and facility procedure. Sampling unrelated skin, using non-sterile supplies, or applying antiseptic before collection can reduce organism recovery. Question 48. During a patient encounter, a medical assistant notices visible soil on both hands after removing gloves. Which action should be taken before seeing the next patient? Option A. Wipe the hands with a dry paper towel and continue patient care. Option B. Apply alcohol-based hand rub until the hands feel dry. Option C. Wash hands with soap and water using proper friction and drying technique. Option D. Put on a new pair of gloves without additional hand hygiene. The correct answer is option C. Wash hands with soap and water using proper friction and drying technique. Hand hygiene is the foundation of infection prevention, but alcohol-based rubs are not the preferred method when hands are visibly soiled. Soap, water, friction, and thorough drying physically remove organic material and microorganisms. Gloves do not replace hand hygiene, and dry wiping does not provide adequate microbial removal. Question 49. To maintain patient confidentiality, which HIPAA principle should guide disclosure of protected health information? Option A. Use or disclose only the minimum necessary information for the intended purpose. Option B. Share full records whenever another staff member is curious. Option C. Discuss patient information in public areas if no names are used. Option D. Release records to an employer whenever the employer requests them. The correct answer is option A. Use or disclose only the minimum necessary information for the intended purpose. The minimum necessary standard limits access and disclosure to what is needed for a specific task. This protects patient privacy while allowing appropriate healthcare operations. Curiosity access, public discussion, and unauthorized employer release violate confidentiality expectations. Question 50. A provider orders 250 mg of a liquid medication available as 500 mg per 5 ml. How many milliliters should be prepared? Option A. 2.5 ml. Option B. 1 ml. Option C. 5 ml. Option D. 10 ml. The correct answer is option A. 2.5 ml. The concentration is 500 mg in 5 ml, which equals 100 mg per ml. A 250 mg dose requires 2.5 ml when the ordered dose is divided by the concentration. The other values reflect either underdosing or overdosing calculations. Question 51. An older adult becomes dizzy while stepping off the examination table. What should the medical assistant do? Option A. Leave the room to find the provider without supporting the patient. Option B. Assist the patient to a safe seated or lying position and call for help if needed. Option C. Document normal gait without asking any questions. Option D. Encourage the patient to keep walking to improve balance. The correct answer is option B. Assist the patient to a safe seated or lying position and call for help if needed. Dizziness during transfers creates an immediate fall risk. The medical assistant should help the patient to a safe position, stay with the patient, and notify appropriate staff according to protocol. Encouraging ambulation or leaving the patient unsupported can result in injury. Question 52. While assisting with a 12-lead ECG, where should lead V1 be placed? Option A. Left mid-axillary line at the same level as V4. Option B. Fourth intercostal space at the left sternal border. Option C. Fourth intercostal space at the right sternal border. Option D. Fifth intercostal space at the left mid-clavicular line. The correct answer is option C. Fourth intercostal space at the right sternal border. Correct precordial lead placement is essential for accurate ECG interpretation. Lead V1 is placed at the fourth intercostal space on the right sternal border. The other sites correspond to different chest leads or general placement landmarks. Question 53. Prior to administering medication under provider order, which safety practice should the medical assistant perform? Option A. Verify the patient, medication, dose, route, time, and documentation requirements. Option B. Administer the medication first and document only if a reaction occurs. Option C. Ask another patient in the room to confirm the medication name. Option D. Skip allergy review when the medication was prescribed today. The correct answer is option A. Verify the patient, medication, dose, route, time, and documentation requirements. Medication administration safety depends on verifying the rights of medication administration before the dose is given. Patient identity, drug, dose, route, timing, and documentation must align with the order and policy. Delayed documentation, unreliable identifiers, and skipped allergy checks increase the risk of medication error. Question 54. A patient misses a scheduled appointment without calling. Which action supports proper office procedure? Option A. Delete the appointment so the schedule looks full. Option B. Post about the missed appointment on social media. Option C, dismiss the patient immediately without following policy. Option D, document the no-show and follow the practice policy for follow-up. The correct answer is option D, document the no-show and follow the practice policy for follow-up. No-shows should be documented and managed consistently according to office policy. Follow-up may involve contacting the patient, rescheduling, or applying an established fee policy when appropriate. Deleting records, public posting, or immediate dismissal without due process is inappropriate. Question 55. Which instruction should be included for a patient wearing a Holter monitor? Option A, keep a diary of symptoms and activities while wearing the monitor as directed. Option B, remove the monitor each night to prevent skin irritation. Option C, ignore symptoms because the monitor records everything automatically. Option D, shower with the monitor unless it begins beeping. The correct answer is option A, keep a diary of symptoms and activities while wearing the monitor as directed. A Holter monitor records cardiac electrical activity over an extended period, and a diary helps correlate symptoms with rhythm changes. Patients should follow instructions about keeping electrodes attached and avoiding water unless the device is approved for it. Removing the device or failing to document symptoms can reduce diagnostic value. Question 56. Which information is part of a complete social history during patient intake? Option A, a coworker's guess about the patient's habits. Option B, the provider's personal opinion of the patient. Option C, only the patient's current insurance deductible. Option D, tobacco use, alcohol use, occupation, exercise, and relevant living situation. The correct answer is option D, tobacco use, alcohol use, occupation, exercise, and relevant living situation. Social history documents lifestyle and environmental factors that can affect health. Tobacco, alcohol, occupation, activity, and living situation may influence screening, counseling, and care planning. Insurance information and unsupported opinions are not substitutes for patient-reported social history. Question 57. Following exposure to blood from a contaminated needle, what is the medical assistant's priority action after safely ending the procedure? Option A, apply a bandage and document the event only in the patient chart. Option B, finish the rest of the day and report the event only if symptoms develop. Option C, wash the affected area and report the exposure according to the facility exposure control plan. Option D, squeeze the wound repeatedly to remove contaminated blood. The correct answer is option C, wash the affected area and report the exposure according to the facility exposure control plan. Bloodborne pathogen exposures require immediate first aid and prompt reporting so post-exposure evaluation can begin without delay. Facility exposure control plans outline reporting, documentation, and follow-up steps. Delayed reporting, chart-only documentation, or manipulating the wound can compromise safety and follow-up care. Question 58. A patient asks the medical assistant, do these lab results mean I have kidney disease? Which response is within scope? Option A, tell the patient to stop taking all medications immediately. Option B, post the results in the waiting room for comparison with others. Option C, explain that the provider will interpret the results and offer to relay the question promptly. Option D, diagnose the condition based on the abnormal value. The correct answer is option C, explain that the provider will interpret the results and offer to relay the question promptly. Medical assistants may collect data and communicate approved information, but diagnosis and interpretation belong to licensed providers. The appropriate response respects scope while ensuring the patient's concern reaches the provider. Diagnosing, giving independent medication orders, or breaching privacy is inappropriate. Question 59. Which finding is most consistent with shock and should be reported immediately? Option A, steady gait and normal skin color after resting. Option B, a healed scar from surgery years ago. Option C, mild hunger before a scheduled lunch break. Option D, cool clammy skin, rapid weak pulse, and confusion. The correct answer is option D, cool clammy skin, rapid weak pulse, and confusion. Shock involves inadequate tissue perfusion and can present with cool clammy skin, weak rapid pulse, altered mental status, and low blood pressure. Immediate escalation is needed because shock can deteriorate quickly. The other findings do not indicate acute circulatory failure. Question 60. Which organ produces insulin to help regulate blood glucose levels? Option A, pancreas. Option B, spleen. Option C, gallbladder. Option D, appendix. The correct answer is option A, pancreas. The pancreas contains endocrine cells that produce insulin, a hormone essential for glucose regulation. This concept is frequently tested because diabetes care is common in ambulatory settings. The spleen, gallbladder, and appendix do not have insulin production as their primary function. Question 61. Which site is appropriate for a dermal puncture on an infant's heel? Option A, The arch of the foot near the instep. Option B. The tip of the big toe near the nail bed. Option C. The medial or lateral plantar surface of the heel. Option D. The center of the heel directly over the calcaneus. The correct answer is option C. The medial or lateral plantar surface of the heel. Infant heel punctures are performed on the medial or lateral plantar surface to reduce risk of bone injury. The center of the heel may place the calcaneus at risk, and other foot areas are not recommended routine collection sites. Proper site selection is a key phlebotomy safety concept. Question 62. When collecting a throat culture, where should the swab be directed for the best specimen? Option A. The tonsillar area and posterior pharynx while avoiding the tongue and cheeks. Option B. The outside surface of the tongue after the patient drinks water. Option C. The front teeth and lips. Option D. The inner cheek only. The correct answer is option A. The tonsillar area and posterior pharynx while avoiding the tongue and cheeks. A throat culture should sample the areas most likely to contain the suspected organism, typically the tonsillar region and posterior pharynx. Avoiding the tongue and cheeks reduces contamination with oral flora. Swabbing teeth, lips, cheek, or tongue surface is less likely to yield a useful diagnostic specimen. Question 63. An automated external defibrillator arrives during a cardiac arrest response. What should the medical assistant do if trained? Option A. Turn on the AED, attach pads correctly, and follow the device prompts. Option B. Use the AED only after all emergency responders leave the room. Option C. Wait to use the AED until the patient regains consciousness. Option D. Place AED pads over medication patches without checking the skin. The correct answer is option A. Turn on the AED, attach pads correctly, and follow the device prompts. AEDs are designed to guide trained rescuers through rhythm analysis and shock delivery when indicated. Prompt use with correct pad placement improves the response to sudden cardiac arrest. Waiting unnecessarily or placing pads incorrectly can reduce effectiveness and safety. Question 64. A claim is denied because the subscriber identification number is invalid. Which action should be taken? Option A. Ignore the denial because payers correct all errors automatically. Option B. Verify the insurance information with the patient, correct the claim, and resubmit if appropriate. Option C. Bill a different patient with a similar name. Option D. Change the date of service to make the claim look newer. The correct answer is option B. Verify the insurance information with the patient, correct the claim, and resubmit if appropriate. Claim denials related to demographic or insurance errors should be researched and corrected using accurate information. Verification with the patient and payer records helps prevent repeat denials. Altering dates or billing another patient is improper and potentially fraudulent. Question 65. The suffix itis in the term dermatitis indicates which meaning? Option A. Hardening. Option B. Inflammation. Option C. Removal. Option D. Deficiency. The correct answer is option B. Inflammation. The suffix itis means inflammation, so dermatitis refers to inflammation of the skin. Word part recognition helps candidates decode unfamiliar medical terms. The other meanings correspond to different suffixes and should not be applied to this term. Question 66. A healthcare provider requests an apical pulse on a patient with an irregular radial pulse. How should the medical assistant obtain it? Option A. Estimate the pulse rate from the pulse oximeter waveform only. Option B. Palpate the carotid artery while the patient is standing. Option C. Listen over the cardiac apex for a full minute with a stethoscope. Option D. Count the radial pulse for 15 seconds and multiply by 4. The correct answer is option C. Listen over the cardiac apex for a full minute with a stethoscope. An irregular pulse requires a full minute assessment to capture rate and rhythm accurately. The apical pulse is auscultated at the cardiac apex rather than estimated from a peripheral pulse or device alone. Short counts and carotid palpation are less appropriate for this clinical need. Question 67. Before scheduling a procedure that requires payer approval, what administrative step is often needed? Option A. Submit a claim after the procedure and hope the plan pays. Option B. Tell the patient insurance rules never apply to outpatient care. Option C. Obtain prior authorization according to the insurance plan requirements. Option D. Change the diagnosis code to guarantee payment. The correct answer is option C. Obtain prior authorization according to the insurance plan requirements. Some insurance plans require prior authorization before certain procedures, medications, or services. Completing this step helps reduce denials and informs the patient about coverage requirements. Changing codes improperly or ignoring plan rules can create compliance and payment problems. Question 68. A patient suspected of having active tuberculosis arrives coughing in the waiting area. Which action is most appropriate? Option A. Apply only clean gloves and continue routine rooming procedures. Option B, place a surgical mask on the patient and move the patient to an appropriate airborne isolation area if available. Option C, place the patient near the front desk so staff can observe symptoms. Option D, ask the patient to wait outside until the provider is ready. The correct answer is option B, place a surgical mask on the patient and move the patient to an appropriate airborne isolation area if available. Suspected airborne infections require prompt source control and separation from other patients. A surgical mask on the patient helps reduce droplet nuclei generation, and airborne isolation or facility protocol should follow. Routine rooming, waiting area observation, or placing the patient outside without proper process does not adequately protect patients and staff. Question 69. When creating a written business letter from a medical office, which element is most important for professionalism? Option A, clear purpose, correct grammar, accurate patient information, and appropriate confidentiality safeguards. Option B, visible diagnosis details on the outside of the envelope. Option C, unverified patient details copied from memory. Option D, casual slang so the message sounds friendly. The correct answer is option A, clear purpose, correct grammar, accurate patient information, and appropriate confidentiality safeguards. Professional written communication should be accurate, clear, and privacy conscious. Grammar and formatting affect credibility, while patient identifiers and health information must be handled carefully. Slang, unverified details, or exposed confidential information undermines professionalism and privacy. Question 70. While measuring respirations, which approach is most appropriate for an accurate respiratory rate? Option A, record the respiratory rate from the previous visit if the patient seems stable. Option B, tell the patient to breathe faster so the count is easier to measure. Option C, count respirations only when the patient is talking. Option D, observe chest rise and fall discreetly after assessing the pulse. The correct answer is option D, observe chest rise and fall discreetly after assessing the pulse. Patients may alter breathing when they know respirations are being counted, so discreet observation improves accuracy. Counting chest rise and fall after pulse assessment is a common technique. Coaching the patient, counting during speech, or copying old data produces unreliable documentation. Question 71. When handling controlled substances in the medical office, which practice is expected? Option A, record only the doses that were wasted, not those administered. Option B, store controlled medications in an unlocked cabinet for quick access. Option C, maintain secure storage and accurate inventory records according to policy. Option D, allow staff to share login credentials for medication tracking. The correct answer is option C, maintain secure storage and accurate inventory records according to policy. Controlled substances require strict accountability, secure storage, and complete record keeping. Accurate inventory control supports patient safety and regulatory compliance. Unlocked storage, incomplete records, and shared credentials weaken medication security. Question 72. Which statement about ownership and access to medical records is most accurate? Option A, medical records are public documents available to anyone who asks. Option B, only the insurance company may view the record after a claim is filed. Option C, patients own the original chart and may remove it from the office at any time. Option D, the facility generally owns the physical or electronic record, while patients have rights to access their health information. The correct answer is option D, the facility generally owns the physical or electronic record, while patients have rights to access their health information. Healthcare organizations generally maintain ownership and custody of the record system, but patients have important access rights. Medical assistants should follow policy for record requests and privacy protections. Treating records as public or removable property violates confidentiality and record control standards. Question 73. A patient with limited English proficiency arrives with a minor child who offers to interpret. What is the best action? Option A, use the child for all interpretation because it is convenient. Option B, skip the history because communication will take too long. Option C, arrange for a qualified medical interpreter according to facility policy. Option D, speak louder in English until the patient nods. The correct answer is option C, arrange for a qualified medical interpreter according to facility policy. Qualified medical interpreters improve accuracy, privacy, and informed communication. Minor children should not be used routinely for medical interpretation because of accuracy and ethical concerns. Skipping communication or speaking louder does not overcome language barriers. Question 74. A patient develops crushing chest pain while a medical assistant is attaching ECG electrodes. What should happen next? Option A, stop and immediately notify the provider or activate emergency protocol. Option B, cancel the appointment and ask the patient to drive home. Option C, tell the patient the pain is probably anxiety and continue setup. Option D, finish the ECG before telling anyone because tracing quality is important. The correct answer is option A, stop and immediately notify the provider or activate emergency protocol. New or worsening crushing chest pain may represent a cardiac emergency and requires immediate escalation. The medical assistant should follow emergency procedures rather than delaying for routine workflow. Reassurance without assessment or sending the patient away is unsafe. Question 75. A patient asks for a copy of records to send to a new specialist. What should the medical assistant verify before release? Option A, that the patient pays the full account balance before any records are released. Option B, that only verbal permission from a neighbor has been obtained. Option C, that the release follows facility policy and any required authorization is complete. Option D, that the specialist personally calls the front desk without written details. The correct answer is option C, that the release follows facility policy and any required authorization is complete. Release of health information must follow legal and facility requirements, including valid authorization when required. Proper authorization identifies what information may be released, to whom, and for what purpose. Financial pressure, informal calls, or permission from unrelated individuals is not an appropriate basis for release. Question 76. A patient sends the medical assistant a personal social media friend request. Which response is most professional? Option A, share appointment details through personal direct messages. Option B, post a photo from the clinic to show appreciation for the patient. Option C, maintain professional boundaries and follow the organization's social media policy. Option D, accept the request and discuss the patient's treatment publicly. The correct answer is option C, maintain professional boundaries and follow the organization's social media policy. Professional boundaries protect patient privacy and the integrity of the healthcare relationship. Social media interactions with patients should follow organizational policy and confidentiality rules. Public discussion, clinic photos, and personal messaging can violate privacy and professionalism. Question 77. Which test is an example of a CLIA-waived point-of-care test commonly performed in ambulatory care? Option A, manual blood bank cross-matching for transfusion. Option B, complex tissue biopsy interpretation. Option C, surgical pathology diagnosis by microscopy. Option D, rapid urine pregnancy test performed according to manufacturer instructions. The correct answer is option D, rapid urine pregnancy test performed according to manufacturer instructions. CLIA-waived tests are simple tests with a low risk of erroneous results when performed exactly as directed. Rapid urine pregnancy testing is a common example in medical offices. Complex diagnostic interpretation and blood bank procedures exceed the waived testing level. Question 78. At checkout, a patient's insurance card lists a $25 copayment. What does this usually mean? Option A, the amount is paid only after the annual deductible is audited by the IRS. Option B, the patient owes a fixed amount for the covered visit according to the plan. Option C, the provider must write off every charge automatically. Option D, the patient has no financial responsibility for any service. The correct answer is option B, the patient owes a fixed amount for the covered visit according to the plan. A copayment is a set amount the patient pays for a covered service, often collected at the time of visit. It differs from deductible and coinsurance amounts. The other choices misrepresent patient responsibility and insurance payment rules. Question 79. Which action can contribute to hemolysis of a blood specimen? Option A, using the correct needle size for the vein. Option B, gently inverting an additive tube as recommended. Option C, vigorously shaking the tube after collection. Option D, allowing the antiseptic to dry before needle insertion. The correct answer is option C, vigorously shaking the tube after collection. Hemolysis occurs when red blood cells rupture, and vigorous shaking can damage cells. Additive tubes should be gently inverted the recommended number of times rather than shaken. Allowing antiseptic to dry and choosing an appropriate needle size support specimen quality. Question 80. A medical assistant suspects child abuse based on injuries and the patient's statements. Which action is appropriate? Option A, promise the patient that no one else will be told. Option B, report the concern according to mandatory reporting laws and facility policy. Option C, confront the suspected abuser in the waiting room. Option D, wait several months to see whether the injuries recur. The correct answer is option B, report the concern according to mandatory reporting laws and facility policy. Healthcare workers must follow mandatory reporting requirements when abuse is suspected. Facility policy and state law guide how and to whom the report is made. Delaying, confronting, or promising secrecy can endanger the patient and violate legal obligations. Question 81. Which primary function is associated with the kidneys? Option A, filtering blood and helping regulate fluid and electrolyte balance. Option B, exchanging oxygen and carbon dioxide in the alveoli. Option C, producing bile for fat digestion. Option D, pumping oxygenated blood to the body. The correct answer is option A, filtering blood and helping regulate fluid and electrolyte balance. The kidneys remove wastes from the blood and help regulate water, electrolytes, and acid-base balance. These functions explain why urine tests and renal-related conditions are common in medical assisting. The distractors describe functions of the liver or gallbladder, heart, and lungs. Question 82. During an extremity examination, which statement correctly uses the term distal? Option A. The wrist is distal to the elbow. Option B. The upper arm is distal to the hand. Option C. The elbow is distal to the fingers. Option D. The shoulder is distal to the wrist. The correct answer is option A. The wrist is distal to the elbow. Distal means farther from the point of attachment or origin of a body part. On the upper limb, the wrist is farther from the trunk than the elbow. The other statements reverse the directional relationship. Question 83. Which practice best protects an electronic health record from unauthorized access? Option A. Share one team password so everyone can work faster. Option B. Use individual login credentials and lock the workstation when leaving it unattended. Option C. Write passwords on a note attached to the monitor. Option D. Keep the chart open all day in a public hallway. The correct answer is option B. Use individual login credentials and lock the workstation when leaving it unattended. Air access must be traceable to individual users and protected from unauthorized viewing. Locking workstations and safeguarding passwords support HIPAA compliance and audit integrity. Shared credentials, open screens, and visible passwords defeat access controls. Question 84. An ECG tracing shows wandering baseline artifact. Which cause should the medical assistant assess first? Option A. Patient movement, poor electrode contact, or inadequate skin preparation. Option B. A properly entered date of birth in the air. Option C. The patient's insurance deductible status. Option D. A completed consent form in the chart. The correct answer is option A. Patient movement, poor electrode contact, or inadequate skin preparation. Wandering baseline commonly results from movement, loose electrodes, or skin preparation problems. Correcting electrode contact and encouraging the patient to remain still can improve tracing quality. Administrative details do not explain electrical artifact on the tracing. Question 85. Which statement best distinguishes an adverse drug reaction from an expected side effect? Option A. A side effect can occur only when the wrong patient receives a medication. Option B. A side effect means the medication label was read incorrectly. Option C. An adverse reaction is an unintended harmful response that may require intervention. Option D. An adverse reaction is always the intended therapeutic effect of a drug. The correct answer is option C. An adverse reaction is an unintended harmful response that may require intervention. Side effects may be known, expected, and sometimes tolerable, while adverse reactions are harmful responses that require evaluation. Medical assistants should report concerning medication responses promptly. The other choices confuse therapeutic effects, medication errors, and labeling with pharmacologic response. Question 86. During a telephone triage call, an adult patient reports crushing chest pain and shortness of breath. Which response is most appropriate? Option A. Advise the patient to drive alone to the office for evaluation. Option B. Schedule the patient for the next routine opening in 2 weeks. Option C. Follow emergency protocol and direct the patient to call emergency medical services immediately. Option D. Tell the patient to take a friend's medication and call back tomorrow. The correct answer is option C. Follow emergency protocol and direct the patient to call emergency medical services immediately. Chest pain with shortness of breath can indicate a life-threatening emergency. Medical assistants should follow written protocols and direct activation of emergency services rather than delaying care. Scheduling routine visits, encouraging self-transport, or suggesting another person's medication is unsafe and outside scope. Question 87. Which statement best describes an explanation of benefits? Option A. A legal document naming a healthcare proxy. Option B. A payer document showing how a claim was processed, including allowed amounts and patient responsibility. Option C. A laboratory report confirming specimen integrity. Option D. A prescription label listing medication side effects. The correct answer is option B. A payer document showing how a claim was processed, including allowed amounts and patient responsibility. An explanation of benefits communicates how the insurance payer handled a submitted claim. It may show billed charges, allowed amounts, adjustments, payments, denials, and patient responsibility. The other documents serve clinical or legal purposes unrelated to claim processing. Question 88. A pulse oximeter reads 86% on a patient who appears short of breath. What should the medical assistant do first? Option A. Turn off the alarm and repeat the reading at the end of the visit. Option B. Assume the device is inaccurate and document the value as normal. Option C. Ask the patient to walk around to increase circulation before reporting. Option D. Assess probe placement and the patient's condition, then promptly notify the provider according to protocol. The correct answer is option D. Assess probe placement and the patient's condition, then promptly notify the provider according to protocol. A low oxygen saturation with respiratory symptoms requires prompt assessment and reporting. Checking probe placement helps identify technical error, but patient status must not be ignored. Delaying care, normalizing an abnormal value, or increasing exertion can be unsafe. Question 89. A patient requests an appointment reminder by email. What should the medical assistant consider first? Option A. Using a personal email account because it is faster. Option B. Including another patient's appointment time as a comparison. Option C. Office policy, patient communication preferences, and privacy safeguards for electronic messages. Option D. Sending detailed diagnoses in the subject line for clarity. The correct answer is option C. Office policy, patient communication preferences, and privacy safeguards for electronic messages. Electronic reminders must follow office policy and protect patient privacy. Patient preferences and secure communication practices should be documented when required. Personal accounts, detailed diagnoses in subject lines, and other patients' information create privacy risks. Question 90. After selecting a blood pressure cuff for an adult patient, which finding indicates the cuff size is appropriate? Option A. The bladder encircles most of the upper arm and the cuff fits snugly at heart level. Option B. The cuff is placed over thick clothing to improve patient comfort. Option C. The cuff is loose enough to slide down the forearm during inflation. Option D. The cuff bladder covers only a small portion of the upper arm. The correct answer is option A. The bladder encircles most of the upper arm and the cuff fits snugly at heart level. Accurate blood pressure measurement depends on using a properly sized cuff and positioning the arm at heart level. A cuff that is too small can overestimate the reading, while a loose or misplaced cuff can produce unreliable results. Clothing under the cuff interferes with sound transmission and compression. Question 91. When documenting a patient's pain assessment, which entry is most complete? Option A. Patient reports sharp lower abdominal pain rated 7 out of 10 that began this morning. Option B. Patient seems uncomfortable and probably has severe pain. Option C. Patient pain appears unchanged from last visit. Option D. Pain is noted but the location is not important. The correct answer is option A. Patient reports sharp lower abdominal pain rated 7 out of 10 that began this morning. Pain documentation should include subjective patient report, location, quality, severity, and onset when available. A numeric rating scale supports consistent communication among healthcare team members. Guessing severity, omitting key descriptors, or relying on appearance alone weakens clinical documentation. Question 92. A patient says, "I am scared about this procedure." Which response shows active listening? Option A. Everyone has this procedure, and your fear is unusual. Option B. It sounds like you are feeling anxious. What concerns you most? Option C. The provider is busy, so we need to move quickly. Option D. There is nothing to be scared about, so stop worrying. The correct answer is option B. It sounds like you are feeling anxious. What concerns you most? Active listening reflects the patient's feelings and invites them to share concerns. This approach supports trust and allows the healthcare team to address information needs. Dismissing fear, rushing, or judging the patient can increase anxiety. Question 93. Which statement best describes the purpose of a patient portal? Option A. It replaces all emergency services and after-hours instructions. Option B. It allows secure patient access to selected health information and communication tools. Option C. It allows any visitor to edit another patient's chart. Option D. It is used only to advertise unrelated products. The correct answer is option B. It allows secure patient access to selected health information and communication tools. Patient portals provide secure access to selected records, messages, appointments, and sometimes results or education materials. They support engagement while maintaining authentication and privacy controls. Public editing, emergency replacement, and unrelated advertising do not reflect portal purpose. Question 94. Which instruction is appropriate for collecting a sputum specimen? Option A. Touch the inside of the container lid to steady it. Option B. Spit saliva from the mouth into any available cup. Option C. Cough deeply from the lungs and expectorate into the sterile container without touching the inside. Option D. Brush teeth after collecting the specimen to increase bacteria. The correct answer is option C. Cough deeply from the lungs and expectorate into the sterile container without touching the inside. Sputum specimens should come from deep respiratory secretions rather than saliva. A sterile container and avoidance of interior surfaces help maintain specimen integrity. Saliva, non-sterile cups, and touching sterile surfaces can contaminate the sample. Question 95. A lavender top tube is commonly associated with which additive and test type? Option A. Sodium citrate for coagulation testing only. Option B. EDTA for hematology testing such as a complete blood count. Option C. Heparin for blood cultures. Option D. No additive for urinalysis. The correct answer is option B. EDTA for hematology testing such as a complete blood count. Lavender top tubes typically contain EDTA, which preserves cellular components for hematology tests such as CBCs. Tube additives are a frequent exam topic because collection errors can affect results. Sodium citrate, heparin, and no additive containers correspond to different specimen needs. Question 96. Before assisting with a pelvic examination, which patient position is commonly used? Option A. Prone position with arms overhead. Option B. Lithotomy position. Option C. Sims position for every pelvic examination. Option D. Trendelenburg position only. The correct answer is option B. Lithotomy position. The lithotomy position provides access for many pelvic examinations and related procedures. Proper draping and explanation help maintain privacy and comfort. Trendelenburg, prone, and Sims positions serve different purposes and are not the standard choice for most pelvic examinations. Question 97. Which coding system is primarily used to report medical procedures and services on many outpatient claims? Option A. NDC only. Option B. SNOMED household code. Option C. ICD-10-CM. Option D. CPT. The correct answer is option D. CPT. CPT codes describe procedures and services performed by healthcare professionals. ICD-10-CM codes describe diagnoses and reasons for encounters. Drug identifiers and clinical terminology systems do not replace CPT for procedure reporting on standard outpatient claims. Question 98. During medication reconciliation, which information should the medical assistant collect? Option A. Only medications prescribed by the current provider. Option B. Prescription drugs, over-the-counter drugs, supplements, doses, and frequency. Option C. Only medications that the patient started within the past week. Option D. Medication names without dose or frequency details. The correct answer is option B. Prescription drugs, over-the-counter drugs, supplements, doses, and frequency. Medication reconciliation compares a complete medication list with the current record to identify discrepancies. Prescription medications, over-the-counter products, supplements, doses, and frequency all matter for safety. Limited or incomplete lists can miss interactions, duplications, or adherence problems. Question 99. A patient with diabetes appears shaky, sweaty, and confused while waiting for the provider. Which condition is most consistent with these findings? Option A. Hypoglycemia. Option B. Otitis media. Option C. Constipation. Option D. Hypertension. The correct answer is option A. Hypoglycemia. Shakiness, diaphoresis, confusion, and weakness are common warning signs of low blood glucose. A medical assistant should recognize the pattern and report it quickly according to facility protocol. The other conditions do not best explain the acute neuroglycopenic and adrenergic symptoms described. Question 100. Which action helps prevent errors with lookalike and soundalike medications? Option A. Read medication labels carefully and compare them with the order at each required check. Option B. Rely on the medication's shelf location instead of the label. Option C. Choose the medication with the most familiar-looking package. Option D. Prepare several patients' medications at the same time to save time. The correct answer is option A. Read medication labels carefully and compare them with the order at each required check. Lookalike and soundalike medications require deliberate label checking against the order. Reading labels at the required checks helps prevent selecting the wrong drug. Shelf location, package familiarity, and batching doses create conditions for medication errors.